Good morning. Hi there, Mrs. Wildcat. Thank you for coming into the clinic today. I see you've been following Dr. Whitecoat for management of your vaginal yeast infection, and I see that it has now reached your urinary tract. And as we discussed before, this is a type of fungal infection that is spread by spores, specifically of the fungus Candida albicans. And while your body has a natural balance of bacteria and yeast, when this is disrupted and an unhealthy amount of yeast grows, that can cause some of the symptoms you have now with the burning, itching, redness, and we call that a yeast infection. So this imbalance can come from a lot of things. It can come from antibiotics, oral contraceptives, an impaired immune system, and even uncontrolled diabetes. So it seems like a lot of your health history puts you at risk. You're HIV positive, which kind of impairs your immune system. You're a type 2 diabetic, and it seems like it's not being well controlled right now. And you have been taking a round of aggressive antibiotics for a viral infection. So we'll talk about that all in a little bit, but to treat your yeast infection, the doctor has prescribed you fluconazole or diflucan. Both are the same medicines and will have the same effect. One is simply the generic that I'll be talking about with you today, fluconazole. So this medicine works specifically on the fungal cells causing this infection. These fungal cells stay alive by having this thick cell wall that keeps their contents inside, and fluconazole works to disrupt that cell wall integrity by interfering with the synthesis of a specific component in the cell wall called ergosterol. Um, and so that kind of disrupts that cell wall, killing those cells and helping your infection. And I'll also have you remember that this is not a bacterial infection, so antibiotics won't help treat it, and it will actually possibly make it worse. Excuse me. So before taking this medicine, we're going to run through a couple of questions to make sure if it's still appropriate for you. Are you taking any blood thinners currently, specifically warfarin? No? Okay, good. Do you have any kind of liver dysfunction? No? Okay. Do you take any sulfonylureas for your diabetes? That would be something like glipizide. No? Okay. And do you take Haldol or Dilantin? No? Okay, I just wanted to check with you because some of the side effects, if you're taking warfarin, can be like an increase for bleeding. If you were taking any of those diabetes medicines, you could be at risk for low blood sugar or hypoglycemia. Um, and then if you were taking any of those other medicines, it could disrupt your normal levels of Haldol or Dilantin, those normal drug levels. So we don't want any of that to happen. So it seems that you're still appropriate to take this medicine. And some other side effects that you may see with fluconazole will be redness, itching, and very commonly very severe GI upset. And to help with that, it's best to eat this with food. Um, it can help kind of mitigate some of that. And also, this drug works by being in an acidic environment. So when it reaches your stomach, it knows to work. But this means that you can't take any antacids before taking this medicine or it won't work properly. So no Tums or anything 2 hours before you take this medicine. And this drug also works very quickly and has a rapid absorption in your body to target your urinary tract to help with that yeast infection. So that's very good. But in the meantime, to maybe prevent these yeast infections from reoccurring, we'll try to help better manage your diabetes, through diet, glucose management, and we're going to have you stop taking antibiotics anytime you get a cold or get any kind of viral infection because it seems like it's disrupting your normal vaginal flora. And so we'll see you again in a couple of weeks to see if the treatment worked. And we'll also do a lab workup to check on your liver function, check on your diabetes, and just see how everything's going. So I know that's a lot of information. Do you have any questions right now? And just will you please tell me what to expect while taking this medication? Thank you.